Welcome back to our Facebook page. I am Texas State Senator Bob Hall, serving Senate District 2, which is 9 counties in the eastern part of Texas. And those of you who have been following our Facebook page, you know that we've been very much interested in getting out the truth about the COVID-19 issue and what is really going on out there and what can be done about it. We started with a couple of weeks ago with a rather in-depth interview with 6 doctors, most of which are from Texas, talking about their success in treating COVID patients, keeping them out of the hospital and keeping them alive with tremendous success using existing medications and their good judgment of what they needed. Since that time, there have been a couple of things have happened. One is I've got a number of questions that people have sent in asking, well, that's good to hear from those doctors, but where's the data? Where's the information from the institutions out there that are studying things like this, and where's the data that supports what they're saying? And that coupled with a comment our governor made recently, and I'll paraphrase his response when it was asked about how long is the shutdown, the masks, the isolation going to continue? And his response was essentially, it will continue until we have medicines to treat the COVID. That's a paraphrase, not exact, but it's the point is we do have medicines. They are out there. We have effective medications that are currently being used by doctors, those doctors who are courageous enough to go against the mainstream organizations like the dysfunctional Texas Medical Board and the FDA and the FC, and do for their patients what they should be doing. And between those two, I wanted to put together the information to tell you what others are saying out there, major institutions, and what the data is showing. And so I'd like to run through a little presentation. I've got some slides here. And so let's begin into it. And in doing this, I am just fulfilling what I had promised to do when I was first elected, and that is go do what I said I was going to do and not be necessarily politically correct, but provide you with the truth. And one of the things to support what we've been talking about and is totally in support of what our doctors that were on the previous interview we had is a chart that I found when I took a look at against the FDA, which is which would originally had an emergency authorization for the use of hydroxychloroquine and then withdrew it, which brought into question whether or not the FDA approved it or not. Well, internationally, those countries like Costa Rica, South Korea, Israel, South Africa, Chile, Turkey, India, Russia, etc., which are shown in blue, that actually allowed the use of hydroxychloroquine or encouraged it, have a death rate that is about 1/10 of what the countries like the United States, the Netherlands, Belgium, France, Italy, and United States, UK have. And this is a chart that's in the lawsuit that the AAPS has filed against the FDA. And then I found another chart that is an ongoing collection of data from around the world, some of the similar countries, but you can see those at the top. We start back in March when there were very few deaths, and you can see that those countries that did not allow the use of hydroxychloroquine had a tremendous increase in the number of deaths, growing very high, while those countries like Turkey, India, Indonesia, Morocco, and Malaysia had a very low incidence. There's also a data out there that I don't really had time to put it all together, but those countries that have malaria that use hydroxychloroquine have a very low incidence of the COVID cases in there. So there is a lot of data. There is more than enough data that strongly supports the fact that there are drugs out there that are effective, they're safe, and they're not very costly. In addition to that, the American Association of American Physicians and Surgeons says hydroxychloroquine has about a 90% chance of helping COVID patients. And as studies that report results of treating COVID-19 with the anti-malaria drug chloroquine and hydroxychloroquine, which is Plaquenil, is very common, and it has a 91.6% improvement clinically. Now, this is a very reputable, this is an organization of doctors that are conservative doctors. This is not the very liberal TMA. These are the real doctors who actually care about their patients. And then we have, coming out of the Henry Ford Health System, a report, and they put this out in early July, that treatment with hydroxychloroquine cut the death rate significantly in sick patients hospitalized with COVID-19 and without heart-related side effects, according to a new study published by the health system. This is a very prestigious organization that would not be printing something like this if it wasn't absolutely true and they had the data to back it up. And then one of the leading epidemiologists in our country, Dr. Harvey Rich, who has written extensively, has a number of reports out. Back in May, he put out a report that said early outpatient treatments of symptomatic high-risk COVID-19 patients that should be ramped up immediately as key to the pandemic crisis. And what he said in there, 5 studies, including 2 controlled clinical studies, have demonstrated significant major outpatient treatment efficacy. Hydroxychloroquine plus erythromycin has been used as a standard of care in more than 300,000 older adults with multiple comorbidities. Folks, that is a significant amount of data that shows that these drugs used at the right time, which is early intervention. And that's one of the keys, is to do this early, not wait until the patient is on a ventilator near death to try to start giving them drugs that to get them through this. This is early intervention when they first are tested positive or soon after having symptoms. And then another is the key to feeding the COVID-19 already exists. This is Dr. Harvey Rich, same doctor, later, just recently, that near the end of July, put out this report. And then he says, I am fighting for a treatment that the data fully support, but which, for reasons having nothing to do with a correct understanding of the science, has been pushed to the side. As a patients were done unnecessarily. Fortunately, the situation can be reversed easily and quickly. Folks, that's a pretty strong statement coming from probably the #1 epidemiologist in the country, Dr. Harvey Rich. He says that the situation we currently have can be changed because it's political. It is 100% political that this drug and other drugs are not being used. An update that came out from the Hill from the FDA, and this is from Dr. Hahn, a statement. And asking about the use of the drug, he said that the question you're asking me is a decision between a doctor and a patient. So even the head of the FDA, which has approved this drug for use, is saying that the doctors could use this as a off-label use of the drug, which is a very common practice. And you know, here in Texas, we had a problem with our dysfunctional Texas Pharmacy Board, in that early on they put out a draconian order that directed pharmacies to not fill a prescription for a doctor of hydroxychloroquine unless it was for one of the previously used ailments, such as lupus or rheumatoid arthritis. But managed to get them to change that to just to limit the doctors to a one-time only prescription of a 10-day supply after a rather lengthy discussion with them on it. And then the governor of Ohio ran into the same problem with their pharmacy board, and their governor, who is a man of great courage and foresight, who actually cares about the health of the people of his state. I agree with the statement from Dr. Stephen Hahn, Commissioner of the Food and Drug Administration, that decision about prescribing hydroxychloroquine to treat COVID-19 should be between a doctor and a patient. Folks, what they're saying is let doctors do what they were trained to do, and that is treat the patient, not the symptom. And again, now, as a follow-up to the lawsuit that the Association of American Physicians and Surgeons had filed, they recently filed an update to it, and in it they said that only 1/10 the mortality rate in countries where there is interference with this medication, such as the United States. Again, back to the charts we're talking about, those countries that are allowing it have 90% of their people are surviving. And then it went on to say that the FDA insisted that the public has no right to access the nearly 100 million doses of hydroxychloroquine, which were donated to the Strategic National Stockpile. Now, one of the excuses that our pharmacies were using was there is a shortage of it. There's not enough of it. Folks, we had enough that we sent 2 million doses to Brazil recently for them to use in treating the COVID in their country. If we can send it for their people, why can't we use it for ours? So there is no shortage. That is a myth. It's an outright lie. And in some areas of Central America, officials are even going door to door to distribute hydroxychloroquine. What they're recognizing is that hydroxychloroquine, according to the doctors, has a prophylactic quality to it. That is, would used early on would mean there would be no need for a vaccine. And we know that vaccines are questionable at best, particularly with the COVID. The doctors have said, and there's study after study out there that shows that the vaccine that they have developed for other COVIDs in the past are somewhere between 6 and 40% effective, and some have some very serious side effects to them. And so we have these existing drugs if our governments would just let them be used. But there is a ray of hope, and that is back in July, about the middle of the month, the Texas Pharmacy Board let the restriction on the use of hydroxychloroquine and erythromycin expire. Now, whether they reinstate it or not, I'm sure there's a bit of pressure being brought to them by the pharmacy companies to do it, but at least we have a little bit of relief here in Texas where the doctors are not being restricted by the pharmaceutical. Now, this data that I've just talked about, you can find it online. We've got the information at doctorsdon'tfearcovid.com has information of it up there where there are a listing of doctors who have said they are willing to treat COVID patients with existing drugs. The curves you saw in there are at C19study.com, and you can watch it as the data flows in there for the curves. And then the Association of American Physicians and Surgeons online has all the information I just presented to you with regards to their lawsuit and their positions. So let's talk about the deaths. I mean, folks, we have people that are dying, and those are the key numbers. The data they're putting out talk about the number of cases is really almost irrelevant, because by now we have it spread so far throughout the United States that some way or another, probably the majority of the people are asymptomatic or have been exposed to it. Yet and the more tests we do, the more cases you're going to find that they tested positive for the COVID, but it is so infrequently effective to the point of the person getting sick that most people will go right through it and not even know that they've had it. But in Texas and the United States, as of yesterday, the 4th, there were 156,311 people that have been tagged as having died of the COVID. And there are 7,261 that have been tagged as having died of the COVID in Texas. I use those numbers only because those are the official numbers that are out there. And I can tell you the phone calls I've gotten and the data that has come in, those numbers are not nearly as big as what they're putting out there, because what they're doing is if someone has the COVID, it doesn't matter how they die, they are being registered as being died with the COVID. And I won't go into it, but there's a lot of money to be made by identifying somebody that has died with the COVID coming out of our hospitals. But those countries that have allowed the hydroxychloroquine to be used have a 90% lower death rate. Now, had the United States and Texas continued to allow the use of hydroxychloroquine as it was doing when we first went into the shutdown, we would have saved over 140,000 American lives and over 6,500 Texans lives. Folks, that's a lot of people that should not have died, and they died only because, and it was totally unnecessary that they did, but it was because of the restrictions that were put out there on the use of it that came from the FDA, the dysfunctional Texas Medical Board, the dysfunctional Texas Pharmacy Board, the CDC, the National Institute of Health, and Texas's own Health and Human Services, which has from day one put out misleading and basically false information. Truly, the blood is on their hands for these deaths. They are just as culpable in these folks dying by misleading Texans and not allowing this drug to be used as anyone out there in any other case of the death of someone. And think about this. Compare Texans to killed by our enemies to Texans killed by Texans. In Vietnam, Texas lost 3,417 Texans to the enemy in Vietnam. Right now, Texans killed by Texans is over 6,500 because they were not allowed to use or could not get access to those drugs that could save their lives. Do you see a problem here, folks? Do you see the problem we have here? And why would knowingly withholding medical treatment not be considered murder? The FDA is culpable, the Center for Disease Control, the Texas Medical Board, the Texas Pharmacy Board, presidential and governor advisors, not just in Texas, but in the whole country, Texas Health and Human Services, doctors and hospitals. They should all be held accountable for these unnecessary political deaths. And that's what they are, folks. It is truly political. And the problem is that throughout this whole thing, we have been on a defensive strategy, defense only, and defensive strategies do not win battles or wars. Mask, business closures, isolation, quarantine, no meaningful patient treatment, and only a hope that the COVID will go away, a hope that we might someday get a vaccine, is not a strategy for winning. And couple that with our too late medical treatment is killing patients. And that's one of the keys there, folks, is that, and I know this firsthand, I'm a good friend that experienced what I'm going to describe to you is what a person can expect. You go to the hospital because you think you have the COVID and they do a test. And they say, yep, you've tested positive, but you're not sick enough to be in the hospital. Go home, take a couple of Tylenol, and when you get too sick to stay at home, come back and we'll put you in a comfortable bed. Then we'll move you to a respirator when you have a hard time breathing. And when it gets really hard, we'll put you on a ventilator. And if you happen to survive the ventilator, then you can leave. Otherwise, we'll take you out in a hearse. Late treatment. Folks, there is no other disease that we treat that way. Can you imagine going to the doctor and the doctor says, you have stage 1 cancer. go home, take a couple of Tylenol, and when it gets to stage 4, come back and we will think about doing something to start treating you. I think you'd be outraged if that's what happened. But that is what's happening here in Texas with the COVID. It happened to a good friend of mine recently, exactly that scenario I just described. The hospital had diagnosed him with the COVID and told him to go home and take a couple of Tylenol and monitor his oxygen. And he did that. And when his blood oxygen dropped to 92 and he could barely walk and talk, he went back to the hospital. They looked at his blood oxygen and said, well, it's 92. You're not sick enough yet. Go home and come back when you get sicker. Folks, he could barely walk and talk, but he got in touch with a doctor that was willing to treat using the existing drugs. And in 3 days, he was ready to eat a hamburger. The doctor also said that when he did see him, that he was only about 6 hours away from going into an ICU. But that is what many people are faced when they're going to see the doctor. Defense-only strategy is designed to fail, and it will fail big. There is no way out of this with our economy, the damage being done to families and lives with this defense only of lockdowns and selective shutdowns. It is designed, we need a change in strategy. The solution, because a battle is only won with an offensive strategy. And the solution is to switch to offense, to go after the COVID, to start treating patients with it, to provide the prophylactics that the doctors say are out there that are effective. Allow and encourage the use of existing drugs that are inexpensive. And that's probably that's one of the problems, folks. These drugs out there are just a few dollars compared to the drugs that the pharmaceutical companies hope to be able to peddle in the way of vaccines and others that will cost you thousands of dollars. And let me just here interject an answer to the question that some people say, well, that's anecdotal with what those doctors have done. And I say, no, it is not anecdotal. An anecdotal story is the one when you tell about your Aunt Eloise, who did a concoction of some honey and vinegar and herbs from her garden, mixed it all up together and put it on a wart on her toe, and the wart went away. That's anecdotal. Science is what the doctors have done. What they have done is definable, identifiable, and repeatable. And it's been repeated over and over again. That is science at work. That is a scientific solution. A clinical study that everyone refers to, oh, we have to have a clinical study. We have to have a clinical study in this. A clinical study is a bureaucratic process that allows the pharmaceutical companies to sell a $1 drug for $1,000 because it went through a clinical process. That's the only difference between what the doctors have done and what the pharmaceutical companies that are pushing for a clinical drug would do. We need to promote early intervention treatment. This is what the doctors, every one of them have told me over and over again. We need to be early on. Look at what they're doing in South America. They're actually taking drugs to the people door to door to keep them from getting sick. We're ignoring that, folks. And we need to encourage the prophylactic protocols to build a personal immune system, because its immune system, the doctors say, is what is really actually fighting the COVID. And at the same time, we need to recognize that unlike what we were initially told by the government and the media, is that this was a virus that would attack all ages, all races, all sexes equally. And we know that to be absolutely false. But we have not changed anything of what we're doing in recognition of that. We do have those that are vulnerable. The average age is in the late 70s for deaths, and the vast majority have been over 80. And we need to recognize that we need to protect those that are vulnerable and those who have a compromised immune system. And there are people out there walking around thinking they're absolutely healthy, and they have a compromised immune system. And so those are the ones that need protected. We don't need to have universal shutdown of our economy which in itself is inducing more pain to the population and more problems than we're actually solving. Our suicide rates are up, our domestic abuse is up, child abuse is up, highway deaths, you just name it. It has, as a result of the approach we're taking of defense only, we have an increased number of folks otherwise dying. Defense only is as I said before, is a strategy that's designed to fail. We need a strategy change. We need to go on offense. And we need the public, you and everyone else, to start speaking up. Now, Eric Bonhoeffer has been credited with a statement. Some people question whether he did it or not, but I think whether he said it or not is immaterial. It's absolutely true. To speak or not to speak. And silence in the face of evil is evil itself. God will hold us. Not to speak is to speak, not to act is to act. And so what we need is everyone to start speaking up and letting your elected officials know, the government know, the bureaucracies, our Health and Human Services, the Texas Medical Board, the Texas Pharmacy Board. You need to let them know that enough is enough. It's time that we started actually doing something to treat the COVID. Now, there's more information coming. I'm going to invite you to a press conference that we're going to be holding next week on the 12th of this month at 12 noon. We're going to have somewhere between 9 and 12 doctors from coast to coast, many of them here in Texas, that are going to talk about all aspects of the COVID and what has been found, what is being done in doctors' offices quietly, because these doctors are afraid of retaliation. And believe me, our medical board is running hot and heavy, going after doctors that are treating patients for the COVID out there right now. And so they're very quiet about it, but it's happening. And we'd like to invite you to sit in on that press conference. We're trying to get the word out to the media of what these doctors are actually doing. And if you don't believe that there is some work out there that's preventing it, just take a look at what happened to the group of doctors called America's Frontline Doctors that went to Washington last week and held a press conference. It was broadcast on Breitbart, and within a few hours, there were 20 million people that had viewed what they had to say about it. And that website, or that was taken down. And the website for America's Frontline Doctors.com was shut down. And anybody that would Google that was then directed to a CDC site that was set up to debunk the use of hydroxychloroquine, which is very interesting that the CDC would do that, since on their website themselves, they have a posting of hydroxychloroquine in which they say, when the question is asked, who can take hydroxychloroquine, their answer is any child or adult, including pregnant women and nursing mothers, are safe to take the drug. They all say the only person that they identify that should not take it would be those with psoriasis. So folks, it's time for us to speak up on this issue and let the government know that we are tired of this defense. We need to go on offense. And so with that, I want to thank you for being with us today, and continue to follow us on Facebook. We'll be there, and we'll be continuing to bring you all the latest information as we learn it about what's being done and how it's being done, and information on where you can find doctors to go to actually get treatment that will help you. In the meantime, God bless you, God bless America, and God bless Texas.